the chair of the Genesee County Legislature. And joining me again this morning are Matt Landers, our county manager, and Paul Pettit, our public health director. We wanted to provide you this morning with another community update regarding our COVID data, and we appreciate the media push in helping us to get the information out to our public. Most of all today, we wanted our update to focus on the vaccination. As you know, there's been a whirlwind of information of late from the governor's office, which in turn has led to our phone lines being inundated. I'm going to leave most of that to Paul Pettit, but Matt Landers will also be chiming in shortly and including information as it pertains to our new vaccination schedule. I'm going to focus my remarks on our county workforce, who I just mentioned to you, and they continue to be inundated with calls for residents about getting the vaccine. The silver lining here is that it seems that there's an overwhelming number of people who want to get the vaccine, and that's good news because the more people, the better. Since November, thousands of COVID tests have been administered at the Genesee County Emergency Management and Fire Training Center, and this has required many hands on deck. The untold volunteer hours that are being given and given freely by the staff of Genesee County and also community volunteers is nothing short of heroic. It has been an incredible demonstration of the commitment, all in the name of protecting and promoting public health and our community, which in turn resonates in our economy. And I think that Matt would confirm this. To a person, we have not heard one employee complain, and they continue to volunteer their time and perform their work functions not only as good public servants. I look forward to the day when the pandemic is behind us and we can celebrate and recognize the hard work and the volunteerism of this county workforce and this county community. I thank you. And with that, I'd like to turn the program over to Matt Landers. Matt, good morning.
Good morning. Thanks, Shelley. I'm just going to have a few comments, few notes, and then I'll turn it over to the man with the answers, or as many answers as we possibly can have in this time. We're constantly using the analogy or the saying that we're basically we're flying, we're building the airplane as we're flying it, and that's a reflection of the information that's coming out to us and the data and the resources that we have that we're piecing together for not only our testing but now our vaccinations.
They've had. So again, it's not an issue with getting the vaccine out, it's more an issue of the actual having the vaccine. Locally, just to give an idea, we've received about 1,200 doses into the community side. And when I say community, just to clarify, the nursing homes, those are not included in that. That's been getting completed, as I talked about last week, by a federal program using pharmacies that have been going into our nursing homes around the state. I know that they've been into our Genesee County and Orleans County nursing homes, and I believe they're starting their second round. We don't have any detailed information on how many have been vaccinated out of there, and that included staff and residents. But that program is separate from what we've been doing on the community side. And also on top of that, the hospitals and the FQHCs also received a private bucket of vaccine to vaccinate their employees. So that was all taken care of kind of in a separate allocation. So the doses that I'm mentioning here, the 1,200 for Genesee and basically 1,000 for Orleans are the ones that have been available for the public-facing 1A group and now 1B group. So at this point, we have not received any new allocations. We put requests in, and the way this works is whatever the vaccine receiving entity is, whether it's a provider, whether it's a pharmacy, whether it's a hospital, health department, you put your requests in the week before, and based on the allocation that comes from the feds to the state to the region, you get your allocation to the county. and they're picking and choosing of what locations it goes to. So there's really no local control in this. We're putting our requests in, everybody's putting in the requests, but we're only getting a little dribble, of what's coming out to us. So again, it's taking a bit of time. So far in the region, there's been 78,000 approximately doses to the Finger Lakes region. Our allocation for the 78,000 doses to the state, or in the Finger Lakes region since the beginning. The allocation to our region this week was 8,000 doses. So the Finger Lakes as a whole only got 8,000 doses. Genesee County, 400, Orleans, 200. So that's what came into our counties this week. And again, those have all been kind of already pre-booked up into existing clinics. So again, just trying to reiterate, although folks are eligible, the availability and the ability to push it out is just not there. So we're doing our best with what we have, and that's what's creating the backlog again. So just a little bit on how folks can sign up, and we do have on our county websites, folks can go there and click on a link, and it's showing all the available clinics. And again, I can tell you right now, they are all full, whether they're through us, whether they're through Oak Orchard or through the hospital health systems. There's really nothing available, but we'd encourage you to keep looking back. If vaccine happens to come, we will add on new clinic space. There's no residency requirement when it comes to vaccination, so I would also encourage folks to look around, to surrounding counties. As long as you're in the eligible group, you can sign up for available slots. I have heard of people it's kind of like the lotto right now. You sign up and you may be able to get lucky and find a spot. No guarantee on that, but unfortunately, it's kind of this guessing game where you got to constantly keep looking for available locations. But we would encourage people to keep trying. The other option that we would like folks to do is continue to visit the COVID-19 New York State COVID-19 vaccine webpage. That is a great resource with information, whether you're looking to see if you're in a eligible group, which again has continued to expand. And again, I can't take the time necessarily to go through all that, but I do believe we're getting some links posted up in our chat, which should be helpful for folks if they want to repost those or share those. But I'd encourage you to go to these websites and determine if you're eligible. When you go to there, there's actually a process where you would go through an eligibility tool, and at the end of that, it would show available clinics within 100 miles or so of your location. The other thing that we would like to note is there is a 1-800 number that people can call around vaccine information and getting registered that has been posted by the state. That is a 1-833-697-4829. And again, maybe we'll get that posted in the chat too. Just keep in mind, if people are calling this is for the state vaccination sites. This is not for local registration. And just so everybody's also aware, at the moment there are no local state sites doing vaccination. The state is in the process of standing those up. We haven't heard fully the detail of where those will be. I know there's talk of potentially one at the Dome Marina in Monroe County. We have not been made aware of any local vaccination sites, kind of deja vu of testing at this point. So, but we're going to be at the front end of that. We're going to start vaccinating locally so we can make sure we have local access for our folks. All right, so again, collaboration between the health systems, FQHCs, and us to get the vaccine out at the moment. Pharmacies are coming online. We do believe there's some allocations going to our pharmacies in our counties in both Genesee and Orleans. We do not have all the full details on that. They're kind of under their own umbrella. They've signed up to be a vaccine recipient and vaccinator location. But they're responsible once they receive the vaccine to again get the word out about when they're going to start advertising or how they're going to make appointments. So we are trying to communicate with them a little bit, but again, that process goes through the pharmacies. When it comes to the healthcare side, this is again a bit challenging, but they are reaching out to their patients when they have vaccine. So again, we'd encourage people to be as patient as they can. Whether you're potentially hearing from your healthcare provider. To potentially come in and get scheduled for a vaccine. We know at UMMC, part of Rochester Regional, they're collaborating as part of a healthcare system to do some drive-through vaccinations for their population 75 and older. Again, a very small number, about 50 a day or when they get their allocations. And This is not something where you can make an appointment, you can't call. They're randomly generating folks, and they're calling them directly and telling them a time to show up. So again, the process is a bit challenging, and it's being developed and ongoing as we go along. So again, patience and understanding, and we're doing our best to get that out there. Refer to the websites as best we can. Get folks there to review if you are eligible now. And then also we do know that the 16 to 64 group has been moved in if you have medically some type of underlying health issue or immune compromised. The state has not put out guidance yet on what that really means as far as who would be eligible under those criteria. So as soon as that information comes out, we'll make sure to push that and get that out to everybody. But those folks that may fall under that, they'll also be eligible in the 1B group, including the 65 and above, in addition to all the different professions and careers that fall under that category. So as we move forward, again, as Matt was mentioning, we are in the process of standing up our public pods. At the moment in Genesee County, we will be over at GCC, and the plan is to hopefully launch mid to late next week, vaccine dependent, so more information to come on that. And then we will be hopefully there Monday, Wednesday, Friday, indefinitely, as long as the need is there, to do vaccinations for our residents that, again, qualify. In Orleans County, we're going to be vaccinating on Tuesdays and Thursdays. We're still finalizing the location, but it'll run very similar to the Genesee County Public Clinic. So if you look for our 2-county region, we're going to be doing vaccinations 5 days a week, and hopefully vaccinating upwards of 600 people per day. It all depends on, again, volume and throughput opportunity here. So more to come on that, but it will be here. Unfortunately, I think the biggest challenge we're going to have is, again, the vaccine coming to us in a reasonable time so that we can make sure we can get it out to the folks. But we will be ready on the county side to deliver it. We just need the vaccine to come. All right, so I rambled a little bit on some things, and as I said, I wanted to have plenty of time for Q&A, so we can hopefully get some answers to some of the questions folks may have. So I'm going to turn that over now to questions, and what I guess I would ask is typically what we've been doing here. If you want to ask a question, unmute yourself, just identify with what affiliation you are, and state your name and your question, and then either myself, Matt, or Shelley will do our best to answer it. So we'll turn it over now. Thanks.
Paul, Dan Fisher at WBTA.
Hi, Dan.
I think it was last week or perhaps the week before, you estimated that the number of 1B persons eligible was something like 13,000 in Genesee County. It was quite high. And at the present rate, that's just going to take forever to vaccinate. What do you see in the tea leaves for getting more doses into this area?
Yeah, no, it's a great question, Dan. We're all feeling that pinch. I mean, we're not alone locally, and I think there's just been such a high expectation, that the vaccine, was getting approved, late November, early December. There was a promise of 20 million doses by the end of the year, and that would just continue to flow. I believe it is getting produced. It's really a pipeline issue and getting it out. The other potential good news is here. Remember, there's other manufacturers, AstraZeneca, Johnson & Johnson. They're both in, their stage 3 clinical trials, and hopefully they'll go through the same process of Pfizer and Moderna, where they'll get hopefully FDA emergency use authorization here within the next month or two, which will again put more volume into the pipeline potentially for us to have access to. The bottom line is even though it's been approved for about a month now, it takes time to produce and to get it out. And this is a historic, unprecedented vaccination effort, unlike anything we've ever seen in our country, and probably, hopefully, we'll ever see again. And it's going to take time. And I guess that's why we go back to the patient's end. And the other thing, just to keep in mind, we have to do this twice. So we're doing our 1A groups right now with Moderna, which is what we're using in Genesee and Orleans County. We have to revaccinate those people on day 28. Right, so it's going to slow down even a little bit the progress of vaccinating more folks, as we have to revaccinate with that second dose to get up to that 94-95% efficacy with the vaccine. So, bottom line, I think the as we go forward, the expectation is they'll get more supply into the system, into the chain, which will then be able to receive locally. You're going to have pharmacies, you're going to have providers, you're going to have our public clinics all up and running, and so hopefully the availability at some point will start to balance with the eligibility and the requests, and we'll get to where we need to be so that everybody that wants the vaccine is going to be able to get it. Keep in mind, the governor had said with 1B, they expected the 1B group to take about 14 weeks. That was before he added in the 65 up and the 18 to 64 group with underlying health conditions. So that time frame probably more than likely got extended by that happening. But bottom line, I guess all I can try to articulate is we're going to get it out as quick as we can. The goal is not to have us be the barrier. We want to make sure we have the systems in place to be able to get the vaccine to folks when we get the vaccine. So it's going to be more hopefully a supply chain issue that'll work itself out in the next few weeks.
Hey, Paul, Jeff Petrov, Channel 2 News in Buffalo. Could you maybe explain for people, if there's a senior out there who, is trying to get the vaccine, what would you recommend they do, or anyone who's eligible, what would you recommend they do to try to get an appointment? I know you had mentioned about, calling, that's not really going to help you, and you can look at other counties and things like that. What would you recommend they do?
Yeah, so, again, we appreciate the frustration and challenge. We know, especially our senior population, we know are the most vulnerable, right, that we've seen throughout this pandemic. COVID has hit them particularly hard, especially 75 and older, and those in our, long-term care facilities. So we want to make sure we're still prioritizing those folks and getting them vaccinated as quickly as we can. Again, each county, I believe, is setting up some processes as far as local numbers that folks can call. In Orleans and Genesee County, we're working with our Office for the Aging to help facilitate the process of, getting information and helping to register. Again, the problem is the vaccine and the availability of the clinic space is really the issue. With the higher senior population, again, as I mentioned earlier, healthcare providers are the plan, again, through the state, is that those folks and are going to be reaching out to their patients. And again, it's depending on vaccine. So hopefully your provider will be reaching out to you at some point. Again, I would caution to start overwhelming them with phone calls. They don't have the capacity to handle those, just like we don't. I think it's more of one of those, just we're going to have to stay tuned. We're going to have to continue to articulate as best we can on a regular basis to the public of where we're at with our vaccine numbers and where these folks can go. And I know it's frustrating. It's a bit of a challenge right now, but we're doing our best to try to manage that. We do know that the hubs are setting up potentially some additional call banks, potentially using 211 and some other community resources to help field calls and field questions on vaccination locations and the process of getting registered.
Paul, Dan Fisher again. There is this bottleneck. I mean, with all of these millions of doses that are being prepared across the country, but yet we're, like, I got this right, only 400 doses received this week in Genesee County. Where is the holdup? Is it at the regional level? Is it at the state level? Is it at the manufacturing level?
Yeah, so I think if you look, it's mainly up chain, I guess, is the answer. So I know it's not local, and I know regionally it's not regionally, right? I'm on daily calls with the Finger Lakes region. Everybody's in the same boat. No one's receiving a lot of vaccine. As I mentioned, this week the allocation for the Finger Lakes region was 8,000 doses for the whole Finger Lakes, the 9-county region. So we're all in the same boat on this. Again, the state had been receiving, I haven't heard their allocation for this week, but early on it was 300,000 doses per week. So again, this is an issue you got all 50 states in the country all seeking their allocation demands. So again, there's a bottleneck in the back end. I believe the manufacturers are pushing it out as quick as they can. But ultimately, hopefully that bottleneck will start flowing a little quicker here. I can't speak to the specifics on, again, that high level view. I just know locally and regionally, that's not the issue in the system.
I think there may be some questions here about what has been done up to this point in terms of vaccinations? And we know we still have a whole lot more to do, but what's been done so far in 1A and 1B?
Yeah, so I'll be honest with you, we are still finishing up the 1As, right? So if you look at the prioritization groups, those again, the first responders that qualified, the front-facing medical personnel, behavioral health. I mean, those ones that were kind of in those original 1A groups, that's been the priority. The OPWDD groups, anybody, the residential group homes, all the way through at the moment. The 1B, opening it up to additional folks, has just flooded more into the system. Again, as I mentioned earlier, the expectation was we weren't going to be opening up the 1B potentially for at least another week or two now. The prioritization group is still 1A, but it doesn't mean that 1Bs don't qualify, and if they find appointments, obviously they'll be able to get vaccinated. But again, this is really, the whole idea here is risk-based. We wanted to try to protect, again, those that have been hit the hardest from COVID, which again is, our seniors and those that in our congregate long-term home care settings, and then our healthcare workers, which was the whole prioritization group with 1A. We're still moving through that process, and we want to make sure that those 1A groups are as completed as they're going to be. And to keep in mind, not 100% of these folks are taking the vaccine. I'm hearing from different settings, from anywhere from 60% wanting it up to 70, 80% wanting it. So again, the number isn't 100% always. It's going to vary a little bit per population of those that, want the vaccine at this point in time.
Yeah, we've heard about those issues of, some still having questions about the timeline of the vaccine, whether they want to take it or not. But would you say, by and large, have most of the nursing homes at this point been vaccinated? And do you have a percentage of how many healthcare workers?
Yeah, so on the nursing home side, as I mentioned, we don't have the numbers. I mean, the state has really been overseeing that process, so I guess we'd have to check over on the state side on the numbers. I do believe they are starting round 2, because we know that they were using the Pfizer vaccine, which is every 3 weeks. The original goal by the state was to vaccinate all the nursing homes in the state within the 3-week period, and then redo it again with their second doses. So I know locally, again, they've been in our nursing homes, but I don't have numbers on exactly how many residents and or staff were vaccinated. And on the healthcare side, again, I don't have that number offhand of exactly how many have taken it. From what I have heard, though, it's a good, it's a percentages in the 70s to 75% locally of our healthcare workers. And I think we're hearing more and more of them are signing on. There may have been some hesitancy in the very beginning, and they said, well, I'll wait. But I think as now we're getting more into it, more of them are signing up to take the vaccine.
And do you know how many people are eligible? Forgive me if you already mentioned it, but how many people in total are eligible in Orleans and Genesee County?
Yeah, so I did mention that it's over 50,000 folks, and again, these are kind of by the state bucket numbers. But if you look at the new criteria, it's well over 50,000, so over half, and I think that's probably pretty consistent if you look at any county proportionally. Just based on the priority groups that have been authorized and are now eligible. So it's over 50,000 people in Genesee and Orleans.
Over 50,000 eligible, and you had mentioned about 400 doses in Genesee and 200 in Orleans County.
That were received this week. Yep. So the allocations that came, new doses into the county is what I'm talking about, new doses, right? So we already had some from the previous week, but new doses coming in, that's correct. 400 in Genesee and 200 in Orleans. And again, so far, community facing, excluding nursing homes and healthcare workers, Genesee's vaccinated about 1,200 and Orleans done about 1,000.
And is that about what you're getting per week? 400, 200, or somewhere in that ballpark?
Well, it's early. We just got our first doses last week, and that was the 200 that the counties received. We did put in requests for this week, but we did not get any allocated to us. We have requests in for next week, and it's a week-by-week process, so we're not sure exactly what we're going to receive next week. The hospital's not sure, the FQHCs aren't sure, the pharmacies aren't sure. It's literally, we put our requests in, and based on what comes into the state, to the region, to us, is what comes in. I can. Hi, Howard. All right, so let me clarify the downward trend. This is not like going down a mountain where we're dropping fast. You know, you got to remember our positivity rates were up at 12%-ish. You know, we were unfortunately leading the region, and at some point almost worse than the state at one point, kind of mid or late December. So when I say downward, again, as I shared those percentages, you know, we are down a little bit, you know, still hovering around a 10.8% on the 14-day average and 9.7 on the 7-day average. So you can see that's coming down a little bit. You know, so again, I would surmise that a little bit has to do is we're moving past the traditional holiday season, right? So typically going into Thanksgiving and through holiday, potential holiday gatherings, which we obviously did not encourage this year, into the holiday season with, you know, the different gatherings that come. We're now on the back end of that. You know, we're out almost 2 weeks now from the New Year's, and typically with that incubation period. So I think that's probably lending itself into that a little bit, that we're now working ourselves back into hopefully a little bit better of a smaller positivity rate. But, you know, I mean, I think that probably has a lot to do with it at this point. But still higher than we want to see them. I mean, we'd like that to continue to trend down for sure. I don't think at this point that's going to be an issue. The Moderna vaccine that we've been receiving locally, the expiration date, I believe, is in June. It's like 6 months, and we're getting it out the door as quickly as we're getting it. So I'm not overly concerned with expiration dates at the moment. That could change, I guess, over time. I guess if we go the other direction where there's so much vaccine and there's not enough capacity to deliver it, right? So if we invert things, but at the moment, I think you know, the availability and the length of the expiration, there isn't any issues on that. Yeah, well, I mean, we got to live on hope here, right? You know, the reality is this is new. As I mentioned earlier, you know, this is an unprecedented effort. We're tapping into systems and you know, processes here that we've never really done on this scale anywhere in this country. So, you know, I'd like to think, and I do believe, you know, talking to our hub as they're getting their legs underneath them, and all the counties are getting their legs underneath them, standing up these ongoing long-term clinics to meet the demand, that you know, once everybody kind of, the system kind of equalizes and everybody gets their legs underneath them, that hopefully it'll be running a lot smoother, and there won't be a lot of issues with folks you know, unable to get vaccine, whether it's here locally or in surrounding counties. Yeah, no, I think what we've seen so far is I mentioned earlier, it ranges a little bit, but overall, I mean, I'd say it's well over 75% of the folks in those buckets are taking the vaccine if they have the opportunity. There's definitely not a shortage. We have, as I said, the phones are blowing up, and with 50,000 people eligible, there's a lot of people. I mean, if you went at that, you know, percentage, I mean, you're still talking 40,000 that want it out of that. So again, it's a big number, and you know, we're going to try to get it to them as quick as we can. Testing has been amazing. I can't again reiterate enough the collaboration and the work being done by the county workforce and volunteers that make this happen for our residents in both counties. We've literally been testing over 500 people every time we test. So between the two counties, sans the holiday week, when we only did one day in Genesee County just due to the holidays, we've been testing over 1,500 people per week in our two county region. So that's a lot of tests, and it's gone very smooth. And we've been identifying typically anywhere from 30 to 40 positives every time we do those events. So the positivity rates kind of fluctuated between 5 and 8 to 9%. They've been very successful. And, frankly, I think it's an operation that is hopefully going to allow us to roll right into vaccinations, right? So the same, type of need and volunteers and that collaborative working arrangement. I think if anything, it's kind of help us cut our teeth on the needs and how we're going to be able to work together to meet this need.
Paul, it's Jeff again. Could you enlighten us on whether pharmacies are starting to get it, doctors' offices, grocery stores, obviously you guys have it, but there's supposed to be a lot of other partners also. Where does that stand?
Okay, yeah. So 1B, when that opened up on Monday, the governor also opened up the ability for other entities to receive the vaccine. So this process actually goes back about a month or two ago, where providers, pharmacies, we as a county had to do this. We had to sign off that we wanted to accept vaccine and administer that under the COVID-19 pandemic. So, any provider, any pharmacy that was interested in doing that had to go through that process and become a designated site. If you actually go to the state website, I believe there's a spot that's showing the list of potential available vaccination sites. The problem is, at least earlier this week on that state site, it wasn't showing actually who had vaccine. It just showed the places where they were eligible to get vaccine, which created a lot of phone calls and I think frustration also. But the reality is pharmacies are starting to receive vaccine. We've heard in the region, obviously Wegmans, I believe some Tops, some Rite Aids have also started to receive the vaccine in some of those allocations. Just keep in mind, from our end, and whether it's a pharmacy or provider, they're kind of on their own, I guess. We're not overseeing that process on the local health department process or the health department side. They actually get it directly through their allocations, and they're responsible to set up their own clinics or calls, however they deem forward to move forward and administer the vaccine. We are trying to reach out to those that may have received it already this week in our counties to see exactly who has it and what their plans are, because we would like to help articulate that to the public so that message can get out again if they're going to set up a clinic and how they're going to have people sign up and register. But ultimately that again is being done technically directly between the state and pharmacies and the state and providers. Okay, any other questions? Matt looks bored. He looks like he wants a question.
Well, if I may, it was a really good question about how do we help those who have trouble navigating a website in our older population. And I would encourage everyone just to be a really terrific neighbor and compassionate community member. If you know people that are in this situation, please extend yourself, extend your technological capabilities, and ask. Just ask if people do need help, because this is going to help us cross this mountain range that we have ahead of us of the vaccination process. Again, when this pandemic started, there were just an outpouring of help for each one of our community members and a check just to make sure that folks were okay, if their needs were being met. And we're back there again, reaching out and caring for our neighbors and our friends in our communities is increasingly important in assuring that this vaccination distribution goes well. Again, as Paul said, it is not going to be here today. It's not going to be here tomorrow, that the availability of the vaccine. It's going to be as we experienced with our testing capacity. That took 7 months for us here in Genesee County to ramp up and to receive the capacity. So we know how to be patient, but we're not happy about being patient, right? So we will continue to advocate from the county level, from the health department, from the county managers, in and out of the control room. We absolutely are advocating constantly on behalf of every community member here. Be assured that we are not silent, but help us in being patient. And by all means, we appreciate the frustration and we appreciate the constant changing of the state website. Hang tough, be Genesee strong for us. Thank you.
So, Howard, are you talking about like in facilities or general overall number? Yeah, I mean, I can't speak to unless you want to send over the website and the discrepancy there. So our local data is based upon, again, those that we know were positive cases and that have passed. So, again, I'm not sure where that 90 number will be coming from. Yep. Okay. I think we're all set on our end then. If there's no other questions, again, we're going to do our best to keep doing these and keep pushing information. Again, patients out there, we're going to get the messaging to you as quickly as we can when we have it. And, be safe out there. Continue to wear your mask. Continue to social distance. Continue to minimize non-essential gatherings. Even as we move forward and the vaccine starts to roll out. It's going to be some time. We still need to put in these interim control measures, right, to make sure we're not, again, spreading the virus around and keeping our numbers high. So, continue to seek out vaccine wherever you can if you're eligible, and continue to do the safety measures that we've been practicing for so many months now. Thanks.
Thank you.